Right, let's dive straight into this explainer on coronary artery disease. We're going to unpack what is, frankly, the most common type of heart disease and literally one of the leading causes of death worldwide. But look, rather than just throwing a bunch of grim statistics at you, we're going to break down exactly what's happening inside the body, why it happens, and most importantly, how we can actually fight back. So whether you're a patient yourself, a caregiver, or honestly just someone wanting to take charge of your long-term health, getting a grip on this silent threat is absolutely your first line of defense. So just to give you an idea of where we're headed, here is our roadmap. Section 1 will cover understanding coronary artery disease. Section 2 is the progression of plaque. 3, recognizing the warning signs. 4 is all about diagnosing and treating those blockages. And finally, Section 5, prevention and taking control. Let's get into it. All right, Part 1, understanding coronary artery disease. I want you to think of your coronary arteries like critical pipes. They have one job: continuously supply oxygen-rich blood to your heart muscle. Without that steady flow, your heart just can't function. Now, atherosclerosis, I know it's a seriously intimidating medical word, but it basically just means the silent, gradual buildup of a fatty plaque. This plaque is essentially the primary villain clogging up those vital pipes we just talked about. As cholesterol, fat, calcium, and all these inflammatory substances accumulate in the artery walls, those walls get super stiff and narrow. So what used to be a smooth, wide-open highway for your blood flow becomes really restricted. And the result? Your heart is forced to work way harder while getting less of the oxygen it desperately needs. Now, people mix these two up all the time, but understanding the difference between coronary artery disease and a heart attack is absolutely crucial. They're actually cause and effect. Coronary artery disease, or CAD, is the underlying chronic narrowing of the arteries. This is something that happens over years, sometimes even decades. A heart attack, on the other hand, is the acute event. It's the sudden, complete blockage of that narrowed artery, which immediately starts damaging the heart muscle. So if CAD is left untreated, a heart attack is exactly the dangerous destination it ultimately leads to. Which brings us to Part 2, the progression of plaque. Okay, to really understand this, we need to map out these 5 exact stages. In Stage 1, you've got a healthy artery, smooth blood flow, plenty of oxygen getting through. But as we move into Stage 2, fat and cholesterol start their silent accumulation. Then, by Stage 3, we're seeing significant artery narrowing. This means reduced blood flow, and you might really feel it when your heart's working hard. Stage 4 is where the danger completely spikes. This is a plaque rupture, which triggers a blood clot to form right inside the artery. And finally, Stage 5 is the complete blockage. This is catastrophic. This is the moment a heart attack actually occurs. Seeing it mapped out like this, from healthy flow to total blockage, you can really see exactly why early intervention is so incredibly vital. So how do we stop that 5-stage progression? Well, we have to look at what's driving it, right? Medical science breaks these drivers into 2 camps. First, we've got our non-modifiable risk factors, things like our age, our gender, our genetics, and our family history. We obviously can't change those, but the really important part is focusing on the modifiable risk factors. We're talking about things like smoking, high blood pressure, high cholesterol, obesity. All of these are levers you can actually pull. Controlling these modifiable factors is exactly how you stop that plaque from forming in the first place. Let's move on to Part 3, recognizing the warning signs. Because this disease starts totally silently and builds up over decades, it is absolutely critical that we learn to listen to the warning signs our bodies send us once blood flow drops to dangerous levels. The classic symptom here is angina. And look, this isn't just some simple ache. Patients often describe it as a heavy pressure, a tightness, or just a severe squeezing sensation right in the chest. And it travels, too. It can radiate out to the left arm, up into the neck or jaw, or even across your shoulder and back. You'll often see this accompanied by shortness of breath, especially when you're active, as well as unusual fatigue or unexplained sweating. Basically, if your heart is starving for oxygen, this is how it sounds the alarm. Now, there is a stark and super important contrast here between stable and unstable angina. Stable angina is actually somewhat predictable. It happens when you exert yourself, like say climbing a heavy flight of stairs, and then it improves when you sit down and rest. Your heart needs more oxygen, the narrowed arteries can't quite deliver it, you feel pain, you stop, and the pain fades. Simple enough, right? Unstable angina, though, that is an absolute medical emergency. It strikes while you're just resting, it's significantly more severe, and it doesn't just go away. This is a huge red flag, indicating that a plaque might have just ruptured and a severe blockage is actively forming. The main takeaway here is really straightforward. You absolutely cannot ignore these red flags. If you or a loved one experience severe chest pain, spreading to the arm or jaw, extreme shortness of breath, excessive sweating, or a loss of consciousness, you need to seek immediate emergency medical attention. No waiting around. These are the textbook signs that a heart attack might be actively occurring, and literally every single minute counts when we're trying to save heart muscle. All right, part 4, diagnosing and treating blockages. Transitioning from the problem to the solution, doctors actually have a vast and highly advanced array of tests to spot these blockages before the absolute worst happens. They'll usually start with your medical history and an ECG just to check out the heart's electrical signals. From there, they might use echocardiography to look at the heart's structure, or maybe a stress test to see how it handles pressure. But coronary angiography? That remains the absolute gold standard. They guide a specialized catheter straight to the heart and use contrast dye with X-rays to pinpoint the exact location and severity of the blockage. It literally takes all the guesswork out of the equation. Once they have a diagnosis, treatment starts right away, and it usually begins with some highly targeted medications. Depending on how severe the disease is, your doctor is going to pull specific tools from this medical toolkit. Antiplatelet drugs like aspirin make your blood less sticky, so clots are way less likely to form. Statins work to lower the cholesterol that's building the plaque in the first place. Beta blockers literally reduce the workload on your heart, meaning it needs less oxygen to function. And ACE inhibitors, or nitrates, they help relax and widen out your blood vessels. It's essentially a multi-pronged chemical defense system to keep your blood flowing smoothly. But what happens when those chemical defenses just aren't quite enough? Well, for more advanced blockages, doctors turn to high-tech mechanical interventions. One super common method is coronary angioplasty. They basically inflate a tiny balloon inside the blocked artery to push the plaque out of the way, and then insert a little mesh tube, called a stent, to permanently prop that artery open. For the absolute most severe blockages, they'll perform coronary artery bypass grafting. This is incredible. Surgeons actually take a healthy blood vessel from another part of your body and use it to build a brand new route. They literally bypass the traffic jam entirely to physically restore that blood flow. Before we wrap up the treatments, we have to tackle the single most common question every single patient asks upon diagnosis. When someone hears they have plaque in their arteries, the immediate thought is, can we clear this out? Can coronary artery disease actually be reversed? The honest clinical answer is a bit nuanced. Severe, hardened, calcified plaque cannot usually be completely removed naturally. That's exactly why we rely on stents and bypass surgeries. However, the deeply empowering news here is that early detection, when combined with really aggressive targeted lifestyle changes and the right treatments, can totally halt the progression. It can stabilize those plaques so they don't rupture, and sometimes it can even partially reverse early-stage disease. So the real takeaway is clear. You are not powerless in this fight. Which brings us to our final section, Part 5, Prevention and Taking Control. So how do you actively take the reins here? Well, if you've already experienced a heart event or had surgery, cardiac rehabilitation is your path back to living. And this isn't just about hitting the treadmill at the local gym. It's a fully comprehensive, supervised program designed specifically for heart patients. Physiotherapists guide you through safe aerobic training to rebuild your fitness, but it also includes breathing exercises, targeted nutritional counseling, and crucially, psychological support. Because let's be real, dealing with a heart condition takes a massive mental toll. It's really an all-encompassing education on lifestyle recovery. But for everyone else, whether you're in rehab or just looking to protect your heart right now, everyday prevention is everything. Ultimately, your power lies in your daily choices. Getting regular physical activity, eating a diet that's low in saturated fats, trans fats, and salts, avoiding smoking entirely, diligently managing things like high blood pressure and diabetes, maintaining a healthy weight, and actively managing your chronic stress. You guys, these aren't just polite suggestions from your doctor. Collectively, these daily habits are literally your absolute strongest armor against coronary artery disease. This quote from the clinical guide really just beautifully summarizes everything we've unpacked today. It's a great reminder that while this disease is common and undeniably dangerous, we have the weapons to fight it. Education, awareness, and lifestyle are incredibly potent tools. So, as we wrap up this explainer, I want you to consider this. Your arteries have basically been keeping a silent score of your daily habits for decades. The question now isn't just about what damage has already been done, it's about what single choice you're going to make today to rewrite the ending of your heart story.